Hi, everyone. My name is Tabitha Justice. I am the founder and CEO of Just Us Retirement. And welcome back to one of our weekly webinar series. I am incredibly excited about today's webinar. Out of all the questions I get, this topic is definitely on the top of the list. And I have my two favorite presenters here with me today. So, Carrie, I'm going to start with you. Would you like to introduce yourself?
You, Tabitha. My name's Carrie Payette, and I'm the owner of Amada Senior Care. We're an in-home caregiving company, and we'll get into it a little bit more about what that means later in the presentation.
Okay. And Lisa, would you like to introduce yourself?
Sure. My name is Lisa Polly. I do the marketing at Brookdale Charleston Gardens. We are an assisted living community. I also have a background in healthcare as a nurse. So happy to be here and with two of my favorite people.
All right. So, for those of you watching, Just Us Retirement, what we are is what's considered a collaborative and education focused company. And what that means is we are very upfront that we don't know everything and we don't try to know everything, but we think education is really important. And so, this topic is a super important topic. And as we go through it, the one thing that we really ask is you learn about this for yourself, of course, but sharing is caring. So, what you get from this, share with friends, share with family members. Having to go through caregiving and going through these different stages is incredibly traumatic for people. It's an emotionally very heavy topic. You learning about this topic and learning how to help people could massively impact someone's life in a positive manner if this happens to them. So we're going to go through the different levels of care as we age that people may face. This does not mean they're going to face every single level of these, but they're important to go about. And I'm going to start with you, Lisa. Can you teach me about hospital discharge?
Sure. So I had worked in a hospital for 20 plus years. So something I'm very familiar with. When you are admitted to the hospital, they are actually starting, unbeknownst to you probably, the discharge process. So they're always looking at what's going on with you, taking care of you, but they're always looking at what your next step is. So there are actually different steps, and we're going to go through a lot of those today to try to get folks to understand the process a little bit better. So that's one of the things that we'll do. And then we'll recognize some of the challenges that you're faced and exploring strategies and enhancing the discharge experience. So honestly, being prepared once you're admitted to start thinking about what my next step will be when I'm discharged from here really needs to start in the very beginning of your stay. Yes, I understand that it's very traumatic. You're admitted to the hospital, you're sick, something's wrong. It can be very confusing and hard to follow along with the process. But know that a hospital admission is short term. They're not long term stays any longer. So knowing that can help prepare you and your thought process as to what will my next step be based on the scenarios of being in the hospital. So
Lisa, I want to say one thing about this too is the thing that I've learned from you working on this topic is have a plan before you need it. Because
yes.
most people start planning for this hospitalization while they're in the hospital. And that is a terrible way of planning for this. Like, we should plan while we're healthy and thinking correctly.
Yes, and we recently did a topic discussion on this recently with another recording that was done. But yes, knowing having those difficult conversations with your loved ones in advance to the crisis of your health and displacement from your home, and where do you want to go in the event that you could not come home? What does that look like for you as a spouse, as a sibling, as a child to the individual? Those are questions that really need to be answered and looked at prior to your crisis point. And we're all going to have changes as we age. So don't feel like you're bringing up something that may or may not happen. There will be challenges as we age. That's just part of the process. So
Yep,
good conversation to have. Yes.
absolutely. All
So
right.
the components of a hospital discharge process, of course, they're going to look at your medical status and, review you medically and make sure that you are um, appropriate for the discharge process, medication management. They'll be certainly looking at all of those type of things. Post-discharge care, they'll develop a personalized care plan outlining follow-up appointments, rehab exercises, and necessary home care services that you may need. They'll provide you with education material to take with you to your next step, if that's home or to wherever you're going to be discharged to. Communication, let's just touch on that one. That's a big one. I need to make sure that people understand when they're in the hospital and they're communicating with their healthcare providers there and the discharge social workers, that you are asking questions. Ask the right questions. What are my options? I know both of you all probably get the same experience. I get phone calls every day with mom's in the hospital. I don't think she can go home, and I'm not sure what we need to do. And I don't even know if she's appropriate to come to you guys, or we really want to take mom home. But you need some guidance with that. So the more questions you ask, and the more folks that you get involved with this discharge process, the better results that you're going to have. Don't feel like there's too many questions, and don't feel like you're asking them over and over again. It's okay. This is new to you. We do this every day, but you don't. So just take your time, ask good questions, and gather the information that you need, and rely on the professionals around you that are helping you.
Yeah, and I'm going to throw in for myself too on this. First, we've already talked. We have tons more videos coming out about this, but that hospital discharge, like, people don't understand how important that is, because what if they need like a raised toilet? What if they have rugs everywhere that they're going to trip on? What if, like, there's so much to planning that doesn't just have to stay with the hospital stay, and communication about that and having a really good discharge plan is so important.
I think I'd like to add too that
Yeah.
a lot of times people don't realize that there are social workers and case managers, even if they haven't actually talked to them, someone is working on that behind the scenes. So if you feel like you need some help understanding what to do, or how to get the equipment you need, or what your next steps, ask to speak to one of those people, because they don't go see everybody necessarily. So but they are on every floor of the hospital.
Yeah. So to emphasize that, you got to be your own advocate, or at least have someone there that can advocate for you. All right. Talk to us about some of the challenges and strategies, Lisa.
Yeah, so this is one of the things that is very challenging for folks, is they don't realize how quickly the discharge is coming.
Mhm.
So there was a time that you would go in the hospital and you would fully recover, and then you would go home, and it would be just a very smooth transition. You felt comfortable with your discharge by the time you were ready to go. And that's not the case anymore. Folks are, have surgery and discharge the next day. Lots of different things like that occur. So it's a little bit more challenging, not to go backwards, but pre-planning obviously would help with some of that as well. But the challenges can be confusion about the discharge instructions. They're
Mhm.
giving you a lot of information right up front at the end of your stay, and
Mhm.
you're expected to go home with no medical background and read medical discharge papers and follow along with all these medication management lists, and these were the home meds, and these are the post-discharge meds, and this was the time they gave the last dose of this medicine, and lots of information, and it's very difficult. Then you have to figure out, oh, I got to get these filled, and I got to get them home, and I got to get transportation, and when can I go get the medicine? And so there's a lot of that, and these things can create those emotions of feeling isolated or feeling overwhelmed, which can cause more complications in the process, obviously. So engage your family members and caregivers in this discharge planning. know while someone's in the hospital, start talking about, well, when dad needs to go home, I want brother to take him home, and I will go to the pharmacy, and we will all meet at the hospital and talk with them about the discharge so we all understand what's going on, and try to plan some of that and know that it's going to be coming quickly. If it is just yourself, then I recommend that you try to start with that process and explain to them up front, I'm doing this on my own, and they'll work with you and help you to get services. Depending upon the individual, I recommend honestly that if you're a senior, everyone that's going home goes home with some type of support to follow them, be it home health agency, start looking at in-home care with, say, for example, Carrie, but bring support with you back to your house after being hospitalized, if at all possible. Even a Medicaid patients that have Medicaid, there are support services available to them as well. So when you're discharging and talking to those folks, really explore what those options are are also very important. And look at your networks to promote your successful transition and your discharge outcomes. So,
Carrie, anything you want to add to this?
Thing I would add is that transitioning home safely is a big deal. A lot of people end up right back in the hospital within the first few days, and studies have shown that having a caregiver on hand can really help reduce the early readmission. And the other thing too is, like Lisa mentioned, the medications. That we see so much confusion with the medications because they get all this stuff in the hospital and they go home and they have all the old stuff and they just don't understand, what do I take this? Does this go together? Is this an add-on? And so that's a time of great confusion. So they really need to clarify that clearly before they leave the hospital, or have someone help them figure it out.
Yeah, I love that. All right. So which one of you two want to tackle this one?
I can just give a little bit of a general overview. We're going to go into these a little bit more in depth, but this is just to show that these are some of the options that you may have when you go home from the hospital, or even you don't have to be in the hospital to get some of these services as well. Right. So just bear that in mind. So we're going to talk about home care and home health and the differences between those two things, skilled nursing facilities and nursing home, and the little bit of difference between those two, communities from assisted living to memory care and everything in between, and then palliative care and hospice and what those can look like for families.
Okay. All right, starting the conversation.
So this can be really the hard part, is doing it before the crisis. And as Lisa mentioned, everybody's going to have something at some point. We're all going to have some type of health crisis that, we need some help with. So if you have a plan in place when you're healthy, as you both said, it makes all the difference. But starting the conversation is a challenge, but some of these things can kind of prompt you along to start the conversation. Lisa, you want to add into this?
I do. And you have 3 topics there that are very significant that oftentimes will prompt families to have the conversations. Obviously, the sudden healthcare crisis, the loss of a spouse, very significant. I get that often as well. I'm sure you do, Carrie and Tabitha, too, that they were a team and we lost mom, and now dad is really having the great difficulty of being home. Or I get this often too, mom took care of everything cognitively, but dad was the functional one. So that together they were the whole team. So, and then the other biggie is that holiday visit. I haven't seen mom since last Christmas. We talk every day on the phone, but she's really a good faker. And now I came in and I see the truth. So, if you can get to that conversation before these things, great. But if not, these will prompt you. So, yeah.
Wonderful. Thank you. Home care. All right, Carrie, I know this one's all you.
So we're going to talk a little bit more about what home care is and what it can look like for different families. I think if you go to the next slide, it might have a little bit more detail. So some of the benefits can include keeping independence longer. Lisa and I partner up on a lot of these type of events because we want what's best for our families. Sometimes it's home care and sometimes it's assisted living or another option. So, but in the case of home care, we find a lot of times seniors want to stay home. They want to be independent, and that's what caregiving can do for them. It can also give a lot of peace of mind to their family members. Many times their kids live out of state, and this way they know somebody has eyes on mom or dad, and they can get updates. They can call with questions. It can be very cost effective. If you're just having, some of our clients just have us come in 3 times a week for a few hours. Well, that's the difference in them being able to stay home because we can help them with some bathing or dressing. We can fix some meals, do some laundry, a little bit of the heavier, more challenging things like changing the sheets. But the versus the cost of that versus moving somewhere permanently, if it's just a few hours, sometimes it gets a little bit more expensive if you're talking about a lot more care.
Okay.
You can also just get some respite care. Let's say one of the spouses is the primary caregiver for someone with dementia. Having someone come in for respite a few times a week can be a game changer.
Yes.
Gives them a break, some peace of mind. They can do whatever they want, from take a nap to go to the salon or even go to the grocery appointments, but respite is huge. They can also assist with exercises. We encourage moving around. The old, use it or lose it applies to seniors as well. They can't just lay in the bed and think they're going to get better. They've got to get up and keep moving, and caregivers can assist with that. And as we mentioned, personal hygiene, and then medication reminders. There's a lot of confusion around medications as long as it's packaged some way, whether, a pharmacy pre-pack, or a lot of times the kids will do their medication for a month. We can, assist with reminding and make sure they're taking their medication.
Wonderful. All right. So enriching lives in the home, I feel like, is so important because a lot of people are prisoners in their home. So let's go over some of the ways to make it better.
So one thing we do with every client on the initial assessment is ask what they like to do. What did you like to do? What do you like to do? So we know what some of their interests are. A lot of times music is a big thing that brings the caregiver and the client together. That they always have favorite music, and it really helps bring them back and light them up. If there's things they liked doing, like gardening, well, they can go out together and garden. Sometimes maybe the client might sit on the porch if they're not able to get down anymore, but that's something they still enjoy, and they can direct the caregiver to assist with that. Anything from reading books out loud to going out and about, anything from like a Frosty at the drive-through to going to the library to community events. That's one of our goals and in our core values is enriching the lives of seniors. We don't just want to be, a sitter service coming in and doing the basics. We want to make them enjoy their lives.
Yeah, love that. Anything you want to add to this one, Lisa?
Obviously, personal care, homemaking, companionship care, all of those are extremely important. And Carrie is right. Do not ever forget that enriching their socialization. We saw such a dramatic impact that COVID had on seniors that were self-isolating due to that disease process and pandemic. So we really impatient with in stays here, stays at home. That needs to be a focus no matter where you are. So yeah, Carrie, I like that a lot. That's good.
Okay. And then the home health agencies. Talk to us about this, Carrie.
So this is often where people have a lot of confusion and the difference between home health and caregiving. A lot of times they think when someone says, "Oh, I'm going to get write your prescription for home health," they think they're getting caregiving. But so the main difference is when you think about it, home health agencies provide skilled care. So they're coming in, usually following some type of hospital stay, and they're providing additional rehab services like physical therapy, occupational therapy, and nursing. They have short visits. They're in and out. They come, 2 or 3 times a week, sometimes once a week, just depending upon, what the rehab is like. And it's for a shorter and shorter period of time. They used to come and stay, provide services for several months, but that is decreasing, just like the hospital stays are decreasing. Yeah. So the thought with a lot of families is, oh, great, home health. They're going to provide assist mom with a bath, a sister with dressing, fix her a meal. And so they're kind of surprised that that's not what is included. So that's where the caregiving agencies come in. A lot of times we're in the home together because our services really do not overlap. We provide a different level of care for the clients.
Yeah, and I want to just say on this one, this I feel like I get this call more than anything of, well, my mom got home health assigned to her, and they're not doing any of the custodial stuff like bathing and having to tell people that bathing, eating, things like that, Medicare considers that a long-term care, not something that is necessarily a healthcare need. And that home health agency that's come in, they're not going to do some physical therapy with you and then do your dishes. Like, those are two very different services.
100%. 100%.
I'd like to add that the majority of folks, though, that are being discharged from the hospital could very likely qualify for that in-home therapy and that type thing. So please, if you are watching this, inquire about that. A nurse will come in as well for the initial assessment process and can help you get through that medication confusion and things like that. So even if we're letting you know it's not what it is not, but at the same time, it's okay to bring them in and then work towards what the ultimate long-term goal is for your loved one. So at least you have someone coming, not to stay, not to bathe and all of that, but at least to get a good look at what's going on at home too. So.
And Lisa, do they have to request that? Like, do they have to request it, or is that part of the discharge?
So when they're doing a discharge, they do discharge rounds every day at the hospital. Usually they're in the mornings. And it is all the entities are together. It's the nursing, it's the social service, social workers are there, case coordinators are there. Sometimes you'll have physicians that'll partake in that, depending, or they've already been consulted and we know what their answers are. They meet and they talk about every single patient that's on the floor where you're admitted to. They're in the process. The goal is that they're talking about what your next step is going to be. Discharge rounds are every day, or Monday through Friday, and they do have some on the weekends, but they're every day. So you get admitted today, tomorrow you're in the discharge round process. So the conversations are starting. They make some determinations about what would be the safest discharge for your loved one. What the safest discharge would be for your loved one. And then they'll pursue that conversation with you. If you're not getting that conversation, then you need to ask, what are you all thinking that looks good for discharge? I want to take my mom home. I need some services at home. Can you offer me some options as to what is out there and available? They have lists and they have names, phone numbers, and places that they can refer to you. That's part of their job process. So make sure if they're not coming to you, you are asking. And that leads us into skilled nursing. We've talked about going home. We've talked about home health. But oftentimes, after you're a senior citizen, 80, 90 years old, and you've laid in the bed 5 days, home might not be your next step. You may need to, you've become a little more debilitated with being sick and being in the hospital, and you need a skilled nursing facility stay. There is a short stay that is called a skilled visit. Medicare does pay for that. I need to talk about the myth of the 100 days that they're going to say you can stay for up to 100 days. You forget the up to part. Most folks do not get 100 days. The average stay in a skilled facility stay for rehab and Medicare paying is about 20 days. That's ballpark. Some less, some more. If you have big skilled needs, wound care, new ostomies, things of that nature, you may get more than the 20 days. You may get the 100 days, but that's generally for folks who are having more complicated issues that we don't want to be a part of. So 20 days is about the stay. And at that time, they start doing discharge reviews at the skilled facility that you're at. So once again, when you're admitted under Medicare to pay for a skilled nursing rehab stay, they're starting the discharge process right in the beginning. What's your plan? What's your next step? Because that is short term as well. Sometimes people get a little confused on that too. They'll call me. I know this happens all the time too, Carrie, for you. They'll call and say, "Oh no, I have 100 days. I've got plenty of time. I don't need to worry about what my next step is. I'm going to go ahead and take my vacation when I get back," or whatever. I'm just saying. So no, please listen to. If anything you get from this topic today is that you do not have 100 days. Very, very unlikely. So that's something that we need to really focus on, because you need immediately to start. So, and then once you get to the skilled nursing facility, they once again have social workers and case coordinators that are working on your discharge process with you. So ask those very important questions. Do you think my mom will be able to go home? How is she progressing in therapy? If she's not able to go home, is there assisted livings that we can look at or talk to? What are the options? Nursing home, long-term care stay there on the right listed. That is if you're planning to stay long-term and not leave that facility. There is a difference. Yes, it's the same building, but there are dedicated rooms for the skilled short stay, and there are dedicated rooms and areas for the long-term care patients. Medicare does not pay long-term stay in a nursing home facility. Okay.
Yeah. I'm going to take one more second to emphasize what you just said. Coming from someone who, I mean, we work so much with Medicare clients, skilled nursing, you're not going to get 100 days. Medicare is not, I have seen in the entire 10 years I've been doing this, one time that someone has got 100 days. And then Medicare does not pay for long-term care. And what people think long-term care is not always a thing. They think long-term care is just staying in a nursing home or someone living in your home all day and like helping you take care of yourself, when really it's little things. It's bathing, it's feeding, it's dressing. Medicare considers that long-term care. So
yes, it is
yeah.
certainly. And I want to add one other thing real quick. I know this is a lot of information all up front, and there's even more. But I want people to understand as well, you can't just walk in and admit yourself to a nursing home. So people think, oh, well, I'll just go get admitted to the nursing home when my time comes. There are qualifications to be in a nursing home to stay. You have to have certain needs. Not just anyone can walk over and go, "I'm here for my stay." It doesn't work that way. And with the short-term skilled stay, you have to now, once again, they've reversed that, have to have a 3-day qualifying stay in the hospital in order for Medicare to pay for your stay in a skilled short-term rehab situation. So you can't be at home and say, "Well, I think mom would really benefit from some therapy. Let's call the rehab and get her admitted." In a nursing home skilled setting, that's not the case. Now there are other options, but we're not getting into all that today. But so just know that there's criteria for both admissions.
Yeah, I almost feel like that's a whole other video just in and of itself. I'm working with someone right now. I've been trying to explain for 3 years, we have to start planning for this.
Mm-hmm.
And she waited too long, and now she absolutely cannot live on her own anymore, but can't get in anywhere. Waited too long. So, okay.
Not just qualify for, I mean, basically you're going to have to private pay to stay long-term in a nursing home, which is in the neighborhood of what, Lisa?
12 grand, 14 grand a month right now.
Right.
Some of the smaller facilities are about 9, but just plan to, it's 10,000 plus.
Yeah, at least.
And then you have to have availability. That's the other big thing. There's only so many beds available in this area, and it's not like there's an abundance of beds, and the hospitals are continuously revolving folks in and out. So all of those things come into play for sure.
And one other thing I want to mention about those short-term stays that I hear from a lot of families is that the length of time you're staying is often dependent upon you progressing and improving. And if you're not progressing or improving, you've met your level, or you are not cooperating with therapy, they're going to send you home. It does not matter if you can't get out of bed. I mean, that's the insurance criteria is going to say, nope, you're not meeting the criteria to stay there. And so people are really shocked that they're going home or to an assisted living, whatever it may be. But your time here is done if you're not progressing.
And I think too, like it's the participating part.
Yes.
Yeah.
Okay.
It's not fun to be in pain and have to have rehab services, but you have to do it in order to meet the qualifications to stay longer. That's a requirement.
Yes.
Yeah.
Absolutely.
And they're very strict about it with Medicare.
Mhm.
Yes.
So not to move off that subject, but if you want to move forward, assisted living is another option for discharge.
Mhm.
And Carrie's right. Everybody wants to be home. And I get that every single day. And folks stay home longer and longer. And we understand that too. Carrie and I work very well together. And you would think, oh, we're competitors. We shouldn't even be working with each other because she's keeping them home and I'm in a facility. But it doesn't work that way. We complement each other, and we have folks that live here that use services like Carrie and live in assisted living. So, there's lots of ways that we can work together. But what we do is here, we provide 24-hour nursing care. So in this community where I work, Brookdale Charleston Gardens, there are nurses in the community 24 hours, 7 days a week. And there are care staff here 24/7 that can provide that personal hygiene and that medication management. We provide meals. We do all of your amenity services like housekeeping and laundry services, transportation to medical appointments. Socialization is key. We touched on that earlier. We do provide therapy services in assisted livings. They do. So there's a lot of support. It's just a very good supportive environment for a senior citizen. The challenge, obviously, is the expense. Medicare, Medicaid do not pay, or regular insurance for assisted living. So there has to be some pre-planning with someone like Tabitha so that when the time arises, you're ready and you have the resources available. Another topic that we'll get into another day, I hope, is how to fund for in-home care and assisted living. That's very important topics as well. There are ways that we can talk about how to help benefit you to be able to financially achieve staying somewhere and having care in the home. But that's just a little oversight on or overview of what an assisted living community does provide.
I have one question on this, Carrie. That I said Carrie, but I meant Lisa. Sorry. Lisa, that I would like for you to kind of talk on just briefly. So I get a lot of people afraid to go to assisted living because they think of it as like nursing home style. And every person, when they go to assisted living, they're like, I should have done this so much sooner. Yeah. This is actually, I have friends. It's fun. Will you touch on just kind of briefly that myth?
Absolutely. So, assisted living is not new to us and our generation, but to our parents and their parents, it is a very new concept. We are going to the home. We're going in that place. We're going to be put in there. It is all of those types of things when it comes to your grandparents or even maybe your parents, depending on your age. So their thought process is what they've seen, where their parents were, where their mom and dad were. And it was a nursing home because back then assisted livings did not really exist. The early 2000s is when they really started popping up and gaining more popularity. So we do not have a clinical environment here. It's not like that at all. Our residents have their own apartments and different styles and all of that and services. So we are here to provide the services that you need. Everyone here has different needs. Some folks we help from head to toe every day. Others, we just give them rides to the doctor, so you have different folks, different needs. And that's how we can sort of provide the individualized services to each person. Yes, socialization is key. I have families come in with their loved ones and say, "Oh, my mom's never going to go to that activity. There's no way. She's going to stay in her room. She's been home for 5 years in front of the TV by herself, and I'm just going to tell you, she's not going to." And they'll come back a month later and they're like, "My mom's running bingo. What happened to my mom? Where did she go?" So, yeah, there's just a lot of benefits to being in a community setting. And my recommendation for folks is don't count it out. Go look around. Every community has their own vibe, and find the one that works for you. Make that part of your pre-planning. Go meet with Carrie, learn about what her services are. Stay home as long as you can. But when you cross that threshold of 12 to 24-hour need, you need to start looking and have an option that's the next step there too.
Yep. Love that. Thank you for clearing that up. Carrie, did you have anything?
Yeah, I did want to chime in on just a couple of things. When you're talking about, they're moving into their apartments there, the ones I've seen, people take great pride in their setting up their apartments. They bring all their stuff from home. They're creating a new home. They're beautiful. I mean, so it's not like it's so different from probably what their vision is,
Yes.
number one. And number two, I've had several people move to Lisa's community and other communities. And I mean, I have one that comes to mind, and the ones that have moved in have really thrived. I mean, night and day, shocking, because, with the clients I'm thinking about, it was a couple, and we were there like 7 hours a day, but they really couldn't afford any more than that, but they needed more care, frankly, they really did. And, but they were able to move into the community there. They were able to stay together. And I mean, could not believe how well they did. I mean, it really, the socialization was huge, and they could get all the care that they needed when they needed it. So, I mean, people just need to think about the options. They need to look and evaluate everything and, figure out what's going to work for them.
Go look around. It's free. Get all the knowledge. Get it. Gather it. It's really important.
Yeah.
So, yes.
Yeah, I said this before with you, Lisa, but people will research for months for a 1-week vacation, but they won't research where they're going to live the rest of their lives. It's crazy.
That's so true.
Yeah. Ooh.
Alzheimer's and dementia care. Do you want me to talk about that, Carrie?
Sure.
Okay. So one of the other things that we can provide in a community setting, and Carrie can talk about the in-home piece of that, is we do, and lots of assisted living communities have specialized Alzheimer's and dementia care areas in their buildings. Those are usually separate areas of the community that are just as nice as the assisted living, just as beautiful, same amenities, same food, but the care is specifically designed for someone with Alzheimer's and dementia. It's a completely different need. You can take care of someone with a broken leg. You can take care of someone with a heart attack. But then when you get to someone with Alzheimer's or dementia, it's a whole different form of nursing and care. Mm-hmm. So just if that's something that's on your radar, you have a diagnosis of dementia, your loved one does, or you be looking at things specifically related to that as well. So you don't need that up front now. That's fine. But if your dementia progresses, is the place you're choosing to be, do they have that next step in place for you so you don't have to leave and relocate to a whole new process? So be conscientious about that too.
Carrie, anything you want to say about this in the home care? Or
the only thing I would say is that, everybody's disease presents differently, and they all have unique challenges and things to work through. And, in either situation, we work with the families and the individual to try to find the best solutions, whatever that may be.
All right. Thank you, ma'am. Okay. Supportive care options. Who would like to take this one?
I can take it. So we talked about assisted living and memory care. We talked about, there are also freestanding memory care communities that do not have assisted living attached or affiliated with them. We did not talk about senior day programs. That's something that is available in this area, and they can be very beneficial to your loved ones. Some of those are also income based. So if you do have a diagnosis of Alzheimer's and dementia, you are a caregiver at home, you need 4 hours a day just to sleep, maybe because your loved one has sleep disturbances and they're keeping you up all night. Canal Valley Senior Services provides a day program that is phenomenal, and it is income based. So it's something that is affordable and available to many. So do not count out the fact and say, oh, I don't have the income for assisted living. Okay. I don't have the income for in-home care with Carrie. Okay. Let's look at some options that you do that are available to you. There are resources. You just got to find them. We have over here on the left some of the concerns that you need supportive services to help with. That would be safety issues, obviously personal care, nutrition, med management, activities, and social engagement, and then behaviors that do go along with Alzheimer's and dementia often. So,
All right. Thank you. And then hospice and palliative. So I've also done a really in-depth one with hospice and palliative. So anyone who's watching, if you go to our YouTube, you can find this one really in depth. Actually, I've covered a lot of these topics really in depth that you can find at Just Us Retirement for YouTube. Carrie, would you like to give an overview of this?
Kind of summarize a little bit for you. This is another topic where there is a lot of confusion and a lot of fear. So as soon as you mention one of these two things, people think, oh no, we're on death's door. And that, that may not be anything close to the case. So this is another thing too that can come up with the hospital. You can talk about it with your social worker. If you're not in the hospital, you can talk about it with your physician. And my understanding is you don't even need a doctor's referral. You can call hospice directly to initiate these services. If this is something, even if you just want to find out about it, if you want to have an assessment. But in a nutshell, hospice is when you have a terminal illness. Doesn't mean it's terminal this week. It could be, 6 months or longer, but that's kind of where it comes in play. It has more 24/7 care. They do provide some respite. There's a lot more services that go with hospice. Palliative care comes into play when you have a serious illness and you need some support. Sometimes it's a situation where it's really difficult to get mom or dad out of the house to the doctor. Well, palliative care is awesome because they can come into the home and help out. You can still have you can keep your regular doctor. You can still have home health come in if you want to, if you're trying to improve, if you want to still have rehab services, you can still have them come in, but it's just extra support that's available. And both of these services are covered through Medicare.
Yes. Yep.
One of the things I wanted to add, if I can, is that, and it helps people to understand, we talk about this all the time. Here's one of the ways I describe it to my family members when we start that conversation for palliative care. It is an illness that you're not going to recover from. So it's a progressive disease process. It is Parkinson's. There's no cure for that. And you're not getting well. It could be, of course, dementia and Alzheimer's disease. It could be kidney stage 3 or 4 that you're not going. So when you start thinking, okay, so what would be the qualifying? It is a diagnosis that's a progressive disease process that you're not going to recover from. And that she's right, with all the services they provide, it's really good. So that kind of helps folks that aren't medical to kind of understand, okay, maybe I do qualify for this, or maybe I don't, so.
Yeah. And like I said, we just did a really in-depth one on this. And I think the thing that I thought was most interesting is people think of hospice as you only have like a week or so left.
Right.
They really want you for 6 months. I mean,
Yeah.
that is, there's so many amazing services available, and it's not just for end of life. The last
And when
couple.
you're looking at an assisted living community or in-home services, ask them if they work with hospice. We partner with hospice here. So we know, and I know Carrie does also in the home. So if you're looking at a community and, you know, you might, and your mom has dementia, you might say, hey, do you all work with hospice? And find out what those options are. Because that's, you know, those are valuable services with hospice. They really are.
Completely agree. All right. Hospice admissions. Who would like to take this one?
I'm no expert. So on
I mean, just to touch on this, I mean, the hospitals here locally, and I'm sure around the country, also have inpatient units. So they can bring you over there for assessment to go home with hospice, or they can bring you over there because, let's say, you've gone into the hospital and things aren't going well and it is an end of life situation. They can move you over there. It's a little bit warmer environment, I would say. And they're providing a lot more supportive services for the family as well. So it can, you know, be a shorter term, or they can be setting you up to either go home or go to an assisted living or something else, some next steps. They do also have respite care. So if you are on hospice, your family member can go to their it's not in the hospital, but they have a different building. They can go to Hubbard House for 5 days a month. And so the family member can get some rest and the loved ones still be very well cared for and get all the services they need around the clock.
Yeah, that respite care, I wish more people knew about that. That is amazing. Amazing. Okay, inpatient hospice services. Well, this is kind of local, so I'm going to skip over this a little bit because we do want this to be for everyone. And then I know when I talk to hospice, and again, there's an in-depth video out there. Hospice, people often think of hospice as like it's one person, it's just hospice. But I mean, it's a whole team, and you can still keep your own doctor if you want to. There's social workers, bereavement. It's a whole team helping you through this process. Don't sleep on hospice. I mean, it's an amazing, don't let fear overtake you of going into that process. Home hospice, again, whole video out there about it, but that is, unless one of you guys want to talk about, that's again, the whole team coming into your home, 24-hour care. Anything either one of you could say?
I'll add to that and just say that they are on call 24/7. And I've had 3 grandparents of mine in the hospice service programs. And they were fantastic. And even after the supportive services, after they passed away, they were there for us as a family when we needed something in the middle of the night because we didn't know what to do. So really, you're right. Really check it out and get and see what the options are and see if it's something for you. So 24/7 phone call, immediate answer, get right back to you is a big deal.
My family used hospice when my grandpa passed away. And, you know, my grandma's one of those, oh, my house is a mess. No one can come in. And hospice was so amazing because they took care of all that stuff. So grandma could sit and hold grandpa's hand as long as she wanted.
Sweet.
You know, I mean, it's just hospice is not what people think it is.
No.
And they will do an assessment and let you know, if this is an appropriate situation or not. And sometimes they might say, you know what, I think palliative care may be a better option for you. They're kind of like Lisa and I. They're not trying to pigeonhole you into their services. They're just assessing and offering solutions.
Yep, absolutely. Well, we covered a lot today. So if anyone has further questions, again, first place I would recommend going is either to the YouTube channel or to the Just Us Retirement Education Hub. We have tons and tons of videos in there. Carrie, if they have questions, what's the easiest way of getting a hold of you?
The easiest way to get a hold of me is probably via email, and my email address is up there. But you can also call the office. I'm happy to help. If I'm not in, anyone who answers the phone is usually well versed in and able to answer any questions you may have.
Okay. And Lisa, how about you?
A phone call is really the best way for me. I email as often too, but call the building. And the good thing about that is here at the community, if I'm not available for some reason, someone else will be. So if you are in a crisis and you're like, okay, I'm being pitched out of this skilled facility tomorrow and I'm not available, there's another person that knows the answers besides myself. So even if you are not, even if assisted living is not on your radar or something that you know that is not an option for you, but you have questions about any of these topics, feel free to reach out to either one of us, B or Carrie. We'll be happy to answer because we threw a lot of information out there today and it's a lot to take in. So,
and just as a reminder too, for anyone who's watching, we can walk you through a lot of these different programs. I mean, I know when someone comes to us and they want to discuss long-term care planning and estate planning, I mean, it's not like you're just meeting with one of my agents to work on it. You know, we're going to bring in attorneys to help, Carrie to help, Lisa to help, financial advisors. We're going to do the long-term care. Like, there's a lot that can go into planning this. And I just want to really encourage people, work with people who allow you to explore, because your plan is going to be completely different from your neighbor's plan. Your plan may even be different than your spouse's plan. But planning is important because a crisis will happen. So just plan in advance for it so that you're not forced to do something because no one had a plan. So, all right, ladies, thank you so much for being on here. I know we have a lot of really amazing other programs that are coming out soon, but this was great. So have a wonderful
Tabitha.
day.